This short film will show you what to expect when you come for your planned hip or knee replacement surgery at the Royal United Hospital. The main reason for performing a joint replacement is osteoarthritis, which is simply wear and tear of your joint. Your joint may be inflamed and swollen, causing pain and problems. Joint replacement surgery is the final stage in the management of osteoarthritis. It involves removing the damaged joint surfaces and replacing them with a prosthesis. There are different knee prostheses to suit different patients, and they come in a range of sizes. Most look like this, with a plastic insert between two pieces of metal. There are also a range of different types of hip prostheses. Most look like this, with a piece of plastic between a metal component. On the day of surgery, you will be required to attend the RUH for your operation at 7 AM, unless otherwise informed. Please don't eat anything after midnight, including sweets or chewing gum, as this can cause complications with your anaesthetic. It is important to remain well hydrated for your surgery. You can drink water up to 1 hour prior to your admission. On the morning of surgery, make sure you leave enough time to get to the hospital and find somewhere to park or be dropped off.
Follow the instructions on your admission letter for where you need to go, and on arrival, report to the ward reception. Please check our website for current guidance around whether or not you can bring someone with you. Our nursing team will admit you. They'll show you to your bed where you can settle in. They'll take some basic observations, such as your temperature and blood pressure. You will then be seen by your consultant and anaesthetist prior to surgery, who will answer any remaining questions you might have and ask you to sign a consent form for the procedure. The anaesthetist doctor will talk to you about anaesthetic options and pain relief for after your operation. Please watch our video about your anaesthetic choices for hip or knee surgery. Once our nursing team have admitted you, you could have a long wait before your operation. Now would be a good time to read your book or tablet that you brought with you. Closer to the time of your procedure, a nurse will advise you to get changed into a hospital gown. Please wear your dressing gown and slippers to keep warm. You will then be transferred to theatre on your bed.
In theatre, you will be transferred onto one of our theatre beds in the anaesthetic room. Your anaesthesia doctor and one of the anaesthesia assistants will ask your full name and date of birth and what operation you're having. Then we will attach some routine monitoring equipment, a blood pressure cuff, a heart monitor and a probe on your finger to measure your oxygen levels. Your anaesthesia doctor will need to insert a cannula or drip into the back of your hand or forearm so that they can give you some medicines. If you are having a spinal anaesthetic, then this will be given to you now. You will either need to sit on the edge of your bed or curl up on your side. After the spinal anaesthetic has been administered, the surgeon will help to move you into the correct position for the operation. You will then be moved into the operating theatre with the anaesthetic team. If it is safe to do so, the anaesthetist may offer you sedation during the operation. The anaesthesia doctor will be with you throughout the whole operation.
When the surgery is finished, you will be taken to the recovery room, where a specialist recovery nurse will care for you. They will monitor you regularly to make sure your breathing is fine and that you are well hydrated. It may take a while to come round after your operation, but there will always be someone with you whilst you are waking up. Sometimes anaesthetic drugs can make you feel a bit sick after your surgery. Please let us know if you're feeling nauseous, as there are other medications we can give you to help with this. You will have a drip in your arm to help rehydrate you, and for medications. You may also have a urinary catheter and some nasal specs to help your breathing initially. This is nothing to worry about. After you've been in recovery for a while and you are comfortable, you will be transferred to the ward to continue your rehabilitation. We hope you found this film helpful. If you have any other questions, please call the Pre-operative Assessment Team.